So my name's Yuri Gupta. I'm a diagnostic and interventional radiologist in Brighton at the Royal Sussex County Hospital, part of University Hospital Sussex Foundation Trust. I've been there for 7 years, down on the coast in Brighton, and yeah, I enjoy work. I've got a young family, and life's good. So having been a consultant for 7 years, I'm pretty well established locally. It's a major vascular unit and major trauma centre. So I do a lot of vascular and complex EVAR work, which I enjoy. We work very well with our vascular surgical colleagues. I've recently started on some committees with the BSIR and CERSI, so that's new roles for me, which I'm finding quite exciting and interesting. So yeah, so I feel like my clinical work is fairly steady and well established, and I'm now starting to take on new roles at a national and international level. I do vascular and non-vascular, but I tend to focus more on the vascular side. I suppose that's based on the work that we have in our particular unit, which is a vascular hub. So we have a lot of vascular work locally. And I do enjoy the challenge of what I think of basically as plumbing, unblocking tubes with various devices, and it is very satisfying to go from a state of no flow down a leg, and then to an hour or so later to have blood flowing and potentially saving a foot or a leg. So yeah, it's very satisfying. You get that instant feedback. So I enjoy it. No, I think my current trajectory I'm happy with. As I mentioned, the committee roles allow me to network more widely within the UK and across Europe, and get involved with writing guidelines and other documents and publications. So that's interesting and challenging. I'm currently undertaking a leadership course at my local trust, which is a new venture. It's called Compassionate Leadership Course. So it's quite a different way of thinking about work and about how we interact with our colleagues in a more holistic way, which I think is actually very helpful and interesting and beneficial. So I could see myself in the future taking on more leadership roles locally as well as the committee roles I've currently got. I didn't know about, like most people, I didn't really know about IR when I started. My first exposure to IR or awareness of IR was really as a house officer back in 2003 in Bromley, surgical house officer. I had a patient who had a big gastrointestinal bleed. And I remember my consultant saying to me, this is a situation you see very rarely and may not see in your career again. Although, as it turned out, the career I ended up in, I see it quite often. And because there wasn't a surgical option and all other routes were tried, the final port of call was the local interventional radiologist, who was a sort of mystical figure who we rarely saw. But we got our patient to this magical interventional radiologist, and he managed to stop the bleeding. And all of us looked on in awe. So since then, it was always a slightly mysterious but special place to be, interventional radiology. And then I was actually following a career in surgery, ENT surgery. There was a bit of an upheaval in training back in 2008. Some people watching this may remember MTAS. And following that, many people were sort of forced to change their subspecialty choice. And so I mimoved over to radiology because there were plenty of jobs in that, and it seemed interesting. And I thought interventional radiology is quite procedural and hands-on, and I might enjoy that if diagnostic radiology didn't engage me all the time, which I actually do like the variety of having both sides. And so that's how it turned out. And I went into radiology and ended up really, again, enjoying the exposure to intervention and getting involved in St Thomas's, where I was, guys at St Thomas's in London. And yeah, did a fellowship in Canada, in Edmonton, Alberta, out west. and it was a fantastic fellowship after my time at St Thomas's. I was the only fellow there across 3 hospitals, 9 consultants. There was plenty of work, a lot of all sorts of work, a lot of interventional oncology. So that really was my finishing school before I came back to Brighton. Well, it's a great career. There's, real variety, both within IR and also doing some diagnostics. So you can have that hands-on, you can have a bit more office time work if you like, you can be with patients, you can do clinics. And the most satisfying thing is really seeing a problem, an emergency issue, perhaps a bleed, or and being able to being the only person who can go in there and solve that problem and save a life. So I would recommend it to anybody as a career. And I suppose if you're interested in it, the best thing to do is to go and find your local interventional radiology department, go and speak to the consultants there, go and see what they do, get involved, and take it from there. And obviously you have to go through radiology. That's the first step. And there are a few exams to pass as well, but keep the enthusiasm up and go for it. There are plenty of jobs at the moment, so we do need you.